Once again by Dr. Helen Boucher. She is the Chief of Geographic Medicine and Infectious Diseases at Tufts Medical Center. Thank you for being with us. Want to jump right in and talk about testing. A couple different kinds. PCR testing determines that positive, negative. Antibody testing tells if you're exposed to the virus. But now there's this antigen testing. Tell us what it is and how it could be helpful.
Well, hi, Emily. It's nice to be with you. So antigen testing is a newly approved method that looks for a protein from the outside of the COVID virus, kind of like the flu test that you might have gotten last season or the one before. And it's a fast test that's inexpensive and could be done even at your doctor's office. So that's the good news. The challenge is that it's less sensitive, so it only picks up about 85% of the cases. So this could be used to kind of prove that you have it, and then if it's negative, you might need a second test like that PCR test. But this could be a real game changer for the way we take care of COVID patients if we can get this into doctors' offices, hopefully by the next flu season for sure.
Potentially promising. All right, so Massachusetts reopening, it could begin next week. What are the most important things that people need to do when we're in these early stages to try to keep the virus from spreading?
Well, this is really important, and I think that we need to think about the 3 T's. We need to think about treatment. We have to be able to treat the patients who need us in the hospital, so enough hospital beds and ventilators for people with COVID and for people who are sick in other ways, enough personal protective equipment to protect the healthcare workers. We need to have enough testing to be able to test people, both people who are infected and then people who are exposed to people who are infected. That's very, very important. We need to see the number of cases coming down for at least 14 days. And then we need to have the ability to trace those contacts of infected people so we can contain the virus so we won't have another surge as we open up.
Dr. Fauci testified today it's unrealistic to expect a treatment or a vaccine by the fall, but some colleges in our area have said they will reopen campuses. Maybe you just touched on it here with the 3 T's. What type of precautions do they need to have in their plans?
Well, they need to have all of those and then more, because colleges are places where we have a lot of students kind of packed in together. So they have to really double down on how to manage exposures and how to get those students who might be infected out of circulation into isolation and how to trace those contacts quickly. They're going to be needing even more aggressive cleaning campaigns, ways to keep people separated apart, and ways to do a lot of testing.
All right, a lot of work still to be done. Dr. Boucher, thank you for your insight. We really appreciate it.